It had something to do with muscles. And I can't remember exactly what it was. And I was like, okay, if you give me a piece of paper and a pencil, I can show you how that works. The leg cramps. The leg cramps. Okay? You know. And I was like, give me a piece of paper and pencil and I can show you. He's like, no, that's okay. That's okay. So, our voluntary movements actually start with those higher order brain functions, and it's the actual muscles that are going to respond to it. And when we have this response that is coming out from the sensory directive, put it that way, okay, the sensory input, well, if it's going to be something where we need to maintain muscle tone, control the speed or precision of the movement, we need a direct pathway. This is going to the smaller, more fine-tuned muscles of the body. The direct pathway is responsible for the smaller, fine-tuned muscles of the body. The best example I can give you is our ability to pick up a pen or a pencil and write, or simply pick up a piece of paper. If it's a movement where it doesn't have to be as precise, i.e. walking, you're like, wait a minute, whoa, what? The bigger muscles that we're using for the walking, for example, they don't need something as direct. So their pathway can be indirect. Because this movement, believe it or not, this movement that we do when we walk, for example, it's very jerky. It's not a smooth movement, according to the body, which is kind of cool.
So, as you get older and you're fine-tuned, like to hold things or to write, as that starts to slow down or you can't do it as swiftly as you used to, is that because the neurons aren't firing as fast?
The neurons are not firing as quickly. Yes. This is why damage to the brain or the spinal cord can affect these movements.
Like strokes and things like that.
The strokes, accidents, that sort of thing, maybe a vertebra breaking and damaging the spinal cord. It may actually, or concussion or some kind of brain injury, okay, can actually affect this type of movement.
And they're like misfiring, isn't that actually caused by like a breakdown in the myelin, that it's not able to send the message
That
clearly?
can be a reason. Yes.
When you get older.
When things, and yes, things can happen as naturally because of the way that we do get older, okay? All right. I'm witness to some of these things. And then there can be certain diseases, injuries, many different things that can happen and cause movements to be jerky, movements to not be as smooth, okay? So there are different things that can happen, and it can be due to all of these areas of the brain, the spinal cord, the spinal nerve, all these things.
Sorry, so when you're a young girl, like a baby, obviously you can't hold a pen. Is it because your brain is just not developed enough at that point?
The brain's not developed enough, and there hasn't been the procedure.
So you have to do it, become muscle memory kind of?
A lot of our movements that we make, that we think about the movement, okay? But we don't necessarily have to be 100% aware of the movement, okay? We have already learned the procedure for. It's almost like if you were to go to work in like a manufacturing facility where your job is you do one thing all day long. You get to the point where you don't even think about it anymore. Your mind's off in la la land somewhere going, can 5 o'clock please get here? And at the same time, you're still doing the same thing. Mm-hmm.
Can that happen with things that are like more specialized, like a server talks to people all the time, and they just don't really think it.
Yeah.
Like, yeah.
Yeah, because anything that you're going to do repeatedly, your brain is going to learn it as a procedure. Mm-hmm. Which is one of the reasons I always say, okay, when you're trying to learn, all right, first of all, make yourself uncomfortable, okay? Don't be all nice and comfy in a big old chair, and blah. No, make yourself as uncomfortable as possible, okay? And whatever you're doing, write. And then write in red. You are basically putting so much sensory information into your brain, you're very seldom going to forget it.
Do they understand why using like those pathways over and over again encourages them to work more quickly, or encourages them to, I guess,
Fire quicker?
Yeah. Because obviously you're not developing new path. Like you're not getting new neurons to encourage like a direct pathway or anything like that. So do they know why?
Why doing this type of stuff is helping you learn?
The mechanisms of like why the neuron becomes.
Now, when the brain is developing, okay, like, egg meets sperm, fertilization, itty bitty baby gets here, okay? Itty bitty baby's here, itty bitty baby's got to grow, okay? Well, if you think about it, their head, one of the things that has to happen, it grows. But it's done roughly by the age of 3, okay? In other words, by the time that child is roughly 3 to 4 years old, the size of their head, that's the size it's going to be for the rest of their life. That's why they're so gangly, okay, and always falling over, because they're so head-heavy. Okay, so at that point is when neurons are firing the quickest, okay? But you get to where we are now, you are, okay? For me, everything's degenerate. Okay, young, like now, where you've finished your growth, okay? Yes, what you're doing is you're actually making neurons fire that wouldn't normally be fired. If you weren't studying, if you weren't writing, if you weren't making yourself uncomfortable, all this sort of stuff, believe it or not, those neurons stop. It is true. If you don't use it, you will lose it. That is very true. So what you're doing is you're making them work. Then if you continue that process until, say, you're done with your degree, okay, then when you get done, hopefully you've got a good bit of knowledge stored up there. And as you go to work in the field, things are going to trigger those memories. Practice, practice, practice. So this is basically showing direct pathways versus indirect pathways. So if we have something that's going to be a direct pathway, then that means it goes directly to the area where it needs to synapse and make the movement. We don't have any other areas where it's making little pit stops. So these indirect pathways, those can be many. All right, so the direct pathway is going directly to the area that we need to get the activity from, such as the fine-tuned movement, like something you would need with your fingers. Believe it or not, something you might need from your eyes. You'll be shocked at how small and fine-tuned the muscles of the eyes are. So the brain, in addition to giving us all of this movement, all this memory, all of this emotion, stuff that we have as voluntary, stuff that we have as involuntary, we also have to have our language. It's how we communicate. Every species has it. It doesn't mean that they don't, just because we don't understand it. Okay? Every species has their language. It just so happens that we as humans, we think that we are the one, okay? And we're not. All right? We are not the higher order animal. Trust me on that. Language. We need to understand reading, writing, speaking, and the formation of the words. In the areas of the brain that are going to help with this, we have our Wernicke area and the Broca area. Damage to either one of these is going to have an effect on something. Reading, writing, speaking, understanding, some type of an effect. The Wernicke area, posterior to the lateral, remember the lateral sulcus? These two areas right here, that's my lateral sulcus, okay? It is usually, for the most part, okay? It's the left hemisphere. It's not in the right.
For the Wernicke or both?
For the Wernicke. For the Wernicke area. It recognizes spoken and written language. So what we speak and what we write. When we get ready to speak, there's actual formation of this. This area helps to formulate the phrases and transmits it to our Broca. So what we're going to say gets transmitted to saying it. Ever hear people talk about the filter? Okay? I don't have that filter. They're talking about the fact of it going from the Wernicke to the Broca, and there's nothing filtering out. Well, maybe I shouldn't have said that. Or, oh, oops, did I say that out loud? Oh, no. Okay? Ever come across people who don't have no filter? I'm one of those. The Broca area, once again, left hemisphere. Look at what it does. The motor program, motor, movement, for the muscles of larynx, tongue, cheeks, lips, hands when signing. The muscles that are needed for speech. It's kind of cool.
Would that be hands and writing too, or just for signing?
Well, when people are doing the sign language, I guess because that almost becomes a procedure for them, that this is the reason they put it with the Broca area. Transmits the program to our primary motor cortex, that area of the brain, so that it can make those muscles work.